Hi, my name is Donohoe, and I'm an intern working with leadership initiatives. And I'm really excited to be kind of diagnosing you and helping you today to figure out what's wrong. So could you tell me a little bit about yourself, please?
Okay, you are welcome. Me sunanki Hajiya. Shekara na. Okay. You are the name is Umisa Usman. She's 5 years old.
Sorry?
Hello.
Um,
The patient's name is Umi Salma. She's 65 years old.
okay, wow. Oh my goodness. And do you belong to any tribes or religious affiliations that would be helpful for your diagnosis?
Many addininki. Okay. She says she practices Islam.
Okay. And tell me a little bit about your family, who you live with, if you're married, kind of what your home life is like.
Okay. Gidanku ke kaɗai kike zama ko kina zama da sauran mutane eh? Da yaran ki suna su sha ɗaya, okay. So she lives in a nuclear family setting with her children. They are 11.
Oh, okay. Wait, that's really exciting. Oh my gosh, I bet they're really cute. Okay. So what is your main complaint today? How are you feeling? I understand you're probably not feeling the best. So if you could tell me a little bit about, your symptoms and kind of what's wrong, then I can start helping to diagnose you.
Alright. So ta ce wai tana so ta ji me yake damun ki. Kin ce kafafu? Zazzaɓi ko? Da ɗan ciwon jiki. Okay. So ya kai kwana nawa? Zazzaɓin ya kai kwana uku? To shi kenan. She's feeling she's here today because of fever and then generalized body pain for 3 days.
For 3 days.
Yeah, for 3 days.
Do you have any other symptoms besides, the body pain and the fever, or there's just it?
Okay. So we can amai ne ko gudawa? Okay. All right. She has no other symptoms like vomiting or diarrhea, no abdominal pain, and no
Okay.
headache.
And what kind of a fever was it? Was it a super intermittent fever where it was high and then it went back to normal, or was it pretty sustained and it kept getting higher throughout the day? Like, what was kind of the characteristic of it?
So, zazzabin da kike yi din, jiki na zafi sosai ne ko kuma yakan ɗan je ya dawo ne? So, ba koyaushe ba ne. Okay. Okay, her fever is like on and off.
On and off?
And it's
Okay.
low grade. Yeah, and it's low grade.
Okay. And sorry, to go back to your home life, where in kind of your community do you live? Do you live somewhere with a lot of mosquitoes, or near some standing water, like, a pond or a lake or something, or kind of what's your environment at home like?
So, kina zama a unguwa da akwai yawan sauro ne? Akwai? All right. She lives in an environment where there is stagnant water with mosquitoes around the grasses.
Okay, thank you so much for that. And then do I need to know any like family history or chronic illnesses that you or people in your family have had? So maybe heart disease or difficulty breathing, just so I can learn a little bit more about you and about your family.
To tana so ta ji wai akwai wani rashin lafiya ne a cikin danginku kamar su hawan jini ko suga haka? Babu? Okay, so they have no family history of any chronic illness like hypertension or diabetes
Okay.
or asthma.
Well, that's very good. I'm very impressed. And then, sorry, one last question before I kind of get to the diagnosis. Can you tell me a little bit about your diet? So maybe what foods you eat kind of daily and kind of the nutritional value of the foods you eat?
Okay, so tana so ta ji ya abincin ki kina cin wani abinci kika fi ci ganye ne, a'a masara ne, a'a shinkafa ne, a'a nama kika fi ci? Masara ne? Okay, the food she eats is mainly cereal based, carbohydrate, and rarely does she add vegetable or protein to her diet.
Okay. And then because you practice Islam, are there meats that you can't eat? Or do you eat all meats when you do get to eat them?
Okay, so akwai kalan abincin da baki ci, nama da baki ci ne wanda musulunci ya hana? Okay, kamar alade ko? All right. Yes. She says it's only maybe what she can think of is pork meat that she doesn't eat.
Okay. So I think we're gonna get started on kind of like the diagnosis portion. So if I could, I'd like to run a complete blood test for a rapid test for malaria. And then also could I get a complete blood count as well, just to kind of check her iron and B12 levels as well, please?
All right. The rapid diagnostic test for malaria is positive, showing 1+, and then the complete blood count shows normal values for hemoglobin count. The PCV is 36%.
Okay. So it seems like your blood levels are good, you know. It's always good to eat nutritional foods. So when you can, try to incorporate vegetables or meats, but I understand if that's a little bit more difficult. And then, so it seems as you do have malaria. And so I'm going to go ahead and prescribe ACT. You have uncomplicated malaria, it seems, so it's not super serious. What I would recommend is taking the complete course of treatment so that you know that you've got rid of all the malaria in your system. So the description and kind of instructions for that will be on the medication. But along with the ACT, which is the therapy that's provided for malaria, you should also consider kind of taking in some supportive care. So maybe taking some antipyretics for your fever, having extra fluids just because, you know, when you're sick, your system gets a little worn down, and then kind of resting until you feel a little bit better.
Alright, so likita ta duba ki daga can ta ce yana da kyau a abinci a dinga sa ganye ba iya masara kadai ba, a sa wake, a saka nama ko kifi ko kwai. Ba sa son lami saboda sai ki kiba ki katuwa. So sannan a dinga shiga gidan sauro, a dinga tsaftace muhalli kuma saboda and so keep counseling about the preventive measures, and she's quite happy.
Okay.
And then from my part, I want to commend your effort to making her this diagnosis and then treating your patients using the ACT, which is the correct medication. So well done for a good job.
Thank you so much. And then, yeah, just the prevention methods so that maybe, you know, in the future we don't have you getting malaria again, because that would really be not really good. So just make sure to wear long clothing, especially at night, and move away from a lot of standing water if you're gonna be there for a long time, kind of like a long period of time. And then also, if you do have access to a bug spray, is always a great resource for kind of preventing bug bite that might give you malaria again. But other than that, thank you so much for letting me diagnose you today. I really appreciate it.
To, tana ƙara miki godiya da kuma ƙara jaddada hanyoyin kiyaye cizon sauro. Okay, so she says she has heard all that you have said and she's going to follow them. So she's happy to have you.
Thank you. I hope you feel better
Okay,
soon.
thank you.
Thank
Okay.
you.
Yeah.